Good day. My name is Dr. Nozuko Mkabayi. I'm the Chief Executive Officer or CEO of Rahima Moosa Mother and Child Hospital. So Rahima Moosa Mother and Child Hospital is a specialized regional hospital that offers tertiary services. So by tertiary services, we mean we offer specialized services. So our patients are referred patients from other lower level facilities like clinics and other district hospitals. So we offer in the main of services to mothers and children. However, we do see males as well because we've got an emergency department where they are attended to. So in terms of our mothers and children, so we have specialist obstetricians and gynecologists. So in terms of pediatrics is a specialization in children. We have all the super specialists in pediatrics. So we offer super specialized services. So we offer pediatric cardiology, pediatric neurology, pediatric nephrology. So those are just examples of specializations in pediatrics. We also have got pediatric gastroenterology, that is the gastric specialized in children, who offers psychiatric services or mental health services to mothers and women. And that service is also offered to our staff members when they have emotional issues. They are seen at our mental health unit. Department, what in the olden days used to be called a casualty. So that's where we see our emergencies for both women and children and anybody in the community that may present with an emergency. It's led by a specialized physician in emergency medicine. We also offer what in the olden days used to be called allied health services. It's now called clinical support and therapeutics. So in that team, we have the dietitians. So those are the dietitians that talk about nutrition for our mothers and babies. We have physiotherapists, occupational therapists, social workers, clinical psychologists, and other support. We also have a fully fledged radiology unit that's headed by a professor who's also a head of Vets University. I must also mention that we are a teaching hospital. So we teach undergraduate medical students. So they come here to train when they do their blocks from 4th to 6th year, when they do their blocks in pediatrics and obstetrics and gynecology, as well as radiology. We also teach nurses. We've got a nursing college at Rahima. It's called Rahima Moosa Nursing College. So some of our students come from university. So we have a partnership with the University of Johannesburg and the University of Witwatersrand, Wits University, where there are nurses that are training to become nurses who are doing the degree in nursing. They come for their practicals at Rahima and they're based at Rahima Moosa Mother and Child Hospital. We also offer super specialist services. So we do train, once the doctors have qualified to have the MPCHP, we train them to become specialists. Of note is that I also trained to be a specialist in this hospital 20 years ago. I started my training in pediatrics to become a pediatrician in this very hospital. Also, I must mention, it's quite an old hospital. Next year in March, we will be turning 80 years old. It was opened in March of 1943. And as it were in the olden days, the buildings we were walking around earlier on, the buildings are still standing. There's still that old infrastructure that we had back then. And we pride ourselves, I must say, our staff members, we pride ourselves in giving the best service to our community. We serve a huge community, although we're supposed to serve only really Region B because we're in Region B in the Johannesburg district, but our patients come from far and wide, even up to Region A, which is your Midrand area, and even Region C. So our patients, as I've said, are referred by nurses or doctors, general practitioners, GPs from the clinics, and some from the district hospitals and some regional hospitals as well. So we pride ourselves in the fact that our staff, our motto is that we are a caring hospital. Our nurses, our doctors, our allied health services, even our support staff, our clerks, our porters, our cleaners, and our food services personnel, our security guard. We pride ourselves in offering a caring service to our mothers and children, and even to our visitors that come to the hospital. We pride ourselves on values of integrity, of honesty, of caring, and offering the best service. Because at the end of the day, we want our mothers and our children to walk out of here healthy and happy.